Hello, everyone, and welcome to this webinar today. I'm Francis Seeley from RoboNet 21 and Infra Climate Action Forum, and this is one of the many webinars we do. And today we're going to look at climate change and public health. Now, we've done that quite a lot, but we haven't looked at it from a more global perspective. And today we're going to partly do that with Professor Marla Rao. Now, Marla is a senior clinical fellow at the Department of Primary Care and Public Health at Imperial College. She's also doing a lot of other things. She's actually been an advisor for NHS England. She's been vice chair of WaterAid UK, and I'm sure many other things that she'll tell us about. So welcome today, Marla. And maybe you could just briefly tell us something about yourself to begin with.
Thank you very much, Francis, for this opportunity to contribute to one of your seminars on the climate crisis. I'm a public health physician by background. My career has been, has spanned 4 decades in the NHS, at the Department of Health, and now in academia, across public health practice, public health policy, and academia and research. I have worked on public health issues related to the UK and also in the global arena. And I guess the 3 or 4 areas of greatest focus that I've been interested in, certainly in the last 2 decades of my research and support to policy development, have been health system strengthening, the climate crisis and environmental health, and workforce development for health improvement. So that's a little bit about me.
Well, we'll talk about some of those systems in a minute, but your wide experience has made you convinced more than ever, hasn't it, that the climate crisis is a public health crisis as well?
Oh, absolutely, absolutely. We've WHO published its first reports on estimated additional burdens of mortality because of the climate crisis, at least a decade ago, if not more. And so the mortality, the morbidity, injury across the world because of climate disasters, that toll is just growing, and now it's growing at an alarming pace. Attribution science is much improved, so our ability, or the scientists' ability, to attribute deaths and disease to particular aspects of the climate crisis is getting more accurate. So we can actually see that the human toll of the climate crisis is definitely growing at a massive speed and scale.
And do you see as well that those affected the most are the most vulnerable and disadvantaged in society?
Oh, yes. And that's the case within countries as well as between countries. So it's what we would regard as or term the global north. The developed world has been responsible for the greater proportion of carbon emissions in the past. And yet it has been the developing countries, sometimes referred to as the global south, that is bearing disproportionately the greater burden of deaths and disease because of the climate crisis. But even within countries, even within those developing countries or developed countries, it'll be the most vulnerable, the most deprived communities, which will, and which already are enduring the worst impacts of climate disasters. Yes.
Well, in the developing world or the global south, I mean, you spent 6 years of your life in India doing research on how the poor and disadvantaged are affected in terms of their public health. What did you learn there that can help us understand the impact of climate change?
Well, one of there are so many aspects of the climate crisis which affect populations. And here we're talking specifically about my experience in India. And take water scarcity. As the temperatures, ambient temperatures rise, water scarcity is becoming a truly alarming issue. So from reduced crop yields to just not having regular access to household water required for daily consumption is one of the most serious things affecting rural as well as urban communities. In fact, there have been newspaper reports about what are known as water wars when the weekly tanker of water arrives in, for example, a slum, and there is this massive, anxiety among the slum dwellers to ensure that they access that small amount of water that they may need or secure for their week's needs. So it's absolutely tragic to see that. So there are impacts on water. The water itself has impacts on crop yields, on the amounts people have to drink. There's the impact of vector-borne disease. So the rate at which malaria, dengue, these sorts of diseases, infectious diseases are increasing is again alarming. Then there are the impacts of floods and hurricanes and those kinds of disasters, in especially affecting communities least able to build up resilience and capacity to deal with them. And of course, there are the ferocious heat waves. Recent reports suggest that there are some countries, including India, which are going to see the most rapid rise in temperatures, ambient temperatures, to the point where survivability itself may be, in question.
I mean, you said all that, but in the work that you've done, I think you have been really interested in the impact of climate change on women. Do you think that they're disproportionately affected by climate change in terms of public health?
Yes, indeed. Women are more vulnerable to the climate crisis than men. They make up the larger share of subsistence farmers and have fewer income generating opportunities than men. They manage households and are the primary caregivers in families. So in that regard, they are less mobile and therefore more vulnerable when climate disasters hit their homes and they find themselves in the middle of a flood. The climate chaos makes it harder for them to earn a living and secure food, water, and energy for their homes. Girls are dropping out of school because that daily trek to fetch a pot of water is getting longer and longer. And of course, that's also halving household income because of the time they spend on a daily basis just getting that water for the house. And this cycle of deprivation is just getting worse and worse and worse. And it will only change if women are put at the center of climate negotiations. So yes, it's affecting women in dramatic ways and disproportionately so.
Well, one of the dramatic ways that I think you pointed out is that you've said that where human rights of women are compromised, then they're more likely to die. What makes you say that?
Well, it's things like because women end up being the caregivers, they're often the ones who make up the larger proportion of families on the move. So they're migrating with their children out of rural homes and villages where there literally is no crop left. Harvests are devastated, and they have to move to places where they might just be able to find some work. That puts them in a very vulnerable position indeed, in all kinds of ways, not just from the poverty, but from the point of view of becoming victims of crime, sexual trafficking, and all sorts of things. Then there is the cultural issue, which was highlighted in several papers when it was discovered that when there were climate disasters in some countries, women died in much greater proportions. And that may be because in floods, they're less able to swim, because traditionally it might be that the boys in the family are taught to swim or go out and learn to swim in the sea, whereas girls would be much more protected and not be permitted or encouraged to learn swimming. And some of these, life-saving areas of expertise, if you like, or skill may be denied to them as a consequence. And then there are the broader issues I was talking about, because their education may be maybe at lower levels because of the tradition of educating girls less, their income generating opportunities, their ability to participate in climate negotiation, their access to so many things is reduced. And so all of that puts them at a more vulnerable place, especially in societies where they don't have equal rights to things and goods and services and advantages as men do.
I mean, do you think all of that, and those are huge problems, resonate with the developed world? I mean, we see floods and we see wildfires in Australia and the United States, and it hits the head newsline all the time, but we don't see so much about the problems you just talked about. How can we make that resonate with people in the developed world so they understand the severity of the crisis?
I think that one of the issues is no country is now left unaffected by the climate crisis. Even here in Britain, in 2007, we had, the floods, the massive floods which affected the West Country and resulted in the biggest rescue operation since World War II. I think what is disappointing is that we don't use those sorts of opportunities as times when all of the population could be educated on what's happening and recognize that things that might have happened in the Somerset Levels or in the West Country or in some parts of the country and continue to happen at increasing regularity, could happen everywhere. And to continue to educate the population, all of the population, including those that have been fortunate enough not to have been personally affected until now, about the scale of what's going on elsewhere. That said, I think people are beginning to understand that there are wider impacts all around the world of things happening in the developing world. Because, flights are disrupted, holidays are disrupted, the economy is more uncertain because of our globalization and the fact that we are so inextricably dependent on each other for so many things and so many services. I think people are beginning to understand that. And in some recent polls, I'm sure I've seen that about 75% of Britain's adult population is concerned and wants to do something about the climate crisis and to make a personal contribution to climate action.
Okay, well, let's look at the 2 points you've raised. One is about systematic change in the health services, and the other is about creating dialogue in the community to create more awareness. I mean, you've done quite a bit of work, haven't you, with the Indian government and the UK government about reforming frontline health services in India that will benefit millions of disadvantaged people. How did you do that, and what do you say is the changes we have to make in this country as well?
Well, some of the strategic issues that I've contributed to in India are to do with health financing and universal access to health care. Even in a climate crisis, the likelihood of better access to health care, is I think increased in a primary care focused and primary care centered health system. I'm absolutely passionate about encouraging all countries to look at how they promote and develop their primary care services so that all people, including in remote villages and in rural areas, have access to basic health care within their neighborhoods and their communities. And it's through that network of well-run primary health centers that the best climate response can take place too. So, for example, if there are places where there is an increase in dengue and malaria, then it's through the primary care clinics that we are likely to be able to reach both preventive and curative, health care to populations quickly. If there is a climate crisis, there's a climate disaster, and people need first aid and people need immediate access to care, again, to have well-functioning primary health centers would be the better option in ensuring that life-saving, immediate life-saving care, and also triaging and making sure that appropriate cases are referred to secondary care happens if you have a good, strong primary health system on which the whole healthcare service is built. So that's been one of the things I've been working on and I've promoted for many years now.
I mean, does that mean that GPs have to, reconsider the model they work to? And how easy is that when they're under so much pressure at the moment?
Well, I think it's about, considering the environment, and I'm talking about the socioeconomic and ecological environment within which medicine is being delivered, and it's inevitable that everyone, as the severity of the climate crisis progresses, I think everyone is going to have to consider what can and cannot be delivered in certain circumstances. So, for example, if there is a ferocious heat wave happening, then it's inevitable that GPs and nurses will begin to see referrals, related to the heat stress that the population is facing. And so, it's inevitable that the response is going to have to take that into account. Now, primary care in the developing world will need to also take account of possibly even much more and much bigger issues, such as what to do with in massive floods and with sea level rise affecting so many coastal areas, or in absolutely ferocious heat waves, or when tropical cyclones, affect them and continue to batter their communities with increasing frequency. So primary care services, GPs, nurses, healthcare workers, community workers are going to have to be trained in how to manage healthcare in those circumstances. And I'm afraid that's inevitable. And it's the whole area of healthcare delivery which is going to have to look at what needs to be delivered and how healthcare professionals are trained to deliver those aspects appropriately.
So it's a change of culture and it's a change of practice. But we also need infrastructure changes as well, don't we? And I think you've made that clear on a number of your presentations. I mean, changes in water and sanitation, changes in urban planning, and so on. How vital is that?
Oh, it's absolutely vital. And it's not just about water and sanitation. There's the whole issue within healthcare of supplies, logistics, energy, equipment, delivery, IT. Healthcare delivery is an extremely complex process, and every aspect of it is going to be affected by climate and climate change. In certainly in developing countries, basic water and sanitation issues have been a challenge, and of course that challenge is increasing as the water scarcity becomes worse and worse, with massive rivers being reduced to puddles, frankly, in some parts of the world. So this is something that's going to be challenging climate scientists and policymakers more and more as the climate crisis progresses.
Okay, I mean, on the awareness and education side, we recently done a number of community hubs where we've got people who are often seldom reach what you call voices unheard in the more disadvantaged parts of our world to come together and talk about their concerns around air pollution, lack of green spaces, healthy eating, and many more items, many more issues. And one of the things that came out of that was their feeling that these shouldn't just be one-off. There should be a continuous series of community hubs where people can come together, either in a climate cafe atmosphere where they can talk about their anxieties, or in a climate hub atmosphere where they can talk about further action and contact. How important do you think doing things like that is important in the creating of awareness and the importance of engagement?
But I think it's absolutely crucial, Francis, and I congratulate you on setting up these hubs and continuing these conversations. Because first of all, people need to hear the messages again and again and again, because it takes a while for people to absorb these messages, to understand how they might change their practice, their attitudes, their behaviors, their consumption patterns accordingly. So they need time to reflect on what this actually means for them. And the best way to bring about change is to continue to offer those messages not as a one-off. It's also extremely important for like-minded individuals and those that are beginning to be drawn into climate discussions for the first time, to have a place where they can meet, they can swap ideas, they can understand how neighbors are doing things. It could be anything from better waste management and reducing waste to purchasing greener products, to how one consumes less meat and dairy in a tradition where meat and dairy might have been staple foods people have consumed. So it's natural that people want to hear from others and to gain confidence as a community that everyone can do something to reduce their carbon footprints. So I think it's extremely important, and I'm delighted you're doing this.
One of the, you mentioned the reform of primary care that we have to do, and one of our hubs was at a health centre, and that created a really good relationship. They really liked having us there talking about climate change problems. It inspired them as well as us, and they want a continuing relationship. Is that the sort of reform that can take place that bring communities closer together in dialogue with health centres?
Oh, absolutely. Because one of the issues we haven't touched on yet is the health co-benefits of reducing carbon footprints. So, some relatively easy things that we can all do is to get out of our car and cycle and walk more, eat less meat and dairy, spend more time in nature, uh, 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 spend more time with friends and family, because social connection is so important to our health, well-being, and life expectancy. All of that cuts down on our carbon footprints, but it also improves our health. So, walking more and cycling more are great ways to reduce our risks of overweight, obesity, and reduce our risks of non-communicable diseases, cardiovascular disease, and diabetes. So, these are the sorts of ways by which we could also reduce our dependence and our needs of healthcare, and to have those conversations within health centers is I think a fabulous thing to do, where doctors and nurses and patient groups and advocates can all come together and discuss what is best for our society and do it together.
And is it an example as well of what you might call a collaborative network that's bottom up? It's not a governance network where the statutory authorities set the agenda. It's truly collaborative.
Well, absolutely, and as we know, in many ways, the climate action is being led by young people. It's young people who are compelling governments to think differently, and it's people's movements. Whether they're taking practical action and essentially consuming less, or demanding that places where they've invested their money should be investing less in fossil fuels, or they're eating less meat and dairy, or flying less, or whatever. It's people's behavior which is compelling governments to act differently. So it's very important indeed that there is this continuing bottom-up approach. But it's also the case that we need sympathetic and empathetic and listening organizations. Whether it's our local councils or the NHS or government. We need all of them to respond to our concerns and do things differently. So it takes both sides to come together, but it's very powerful when people come together, they unite, to address a common goal and clamor for change.
So, do you believe that if we do it in the right way, there's still time for our biggest challenge, which is climate change, to also become our biggest hope?
I absolutely believe that. I think there is a good chance that we will crash through the 1.5-degree guardrail. But we have to give it everything we have to ensure that this doesn't get to a point where we are facing climate catastrophe, and there is a risk of that. So we can't reverse changes that have happened or warming that's happened until now, but there is still an enormous amount that we can all do uh, to uh, uh, to reduce the speed of climate change and to ensure that the current climate crisis doesn't turn into climate catastrophe. And the best way to do that is for us to work together, to remain hopeful, to remain optimistic, to be part of this climate movement, and to know that we didn't sit around doing nothing, but we were part of this global movement, which is really the only way we are going to save ourselves and save the planet and ensure a sustainable future for our children and grandchildren.
Okay, well, thank you very much. I mean, we've come to the end of our sort of interview time, and it's been really interesting. And I think your ending to say that there's hope as well as crisis is important, because if you don't have hope, then you give up, and hope is what makes you carry on. So I think that's been good, and all the information you've given, I think, has been incredibly useful, and I'm sure we'll do some more of this in the future. So thank you very much, Marla, for taking part of this. It's been a very important interview. So hopefully we'll do it again sometime in the future around different topics as they develop. But for now, we'll end this interview at the moment. Thank you.
Thank you so much, Francis.